Hello everyone, I'm Dr. John Bray-Morris, and this is the video series Shooting Up in the Dark, where we discuss addiction and all matters related to addiction, including getting clean, recovery, the steps of recovery, how to help a loved one in addiction, opioids and their use for chronic pain, and the dynamics between our medical culture, addiction, and the treatment of chronic pain. Welcome. This video is just to tell you a little bit about what the series of videos actually is. So when you click onto this new channel and see all these different talks, you have a little bit of a guide or organization behind or introduction behind it. I am a physician with 20 years of medical practice experience in various locations. I'm a family physician. I've also practiced a lot of emergency medicine, hospital medicine, and some obstetrics too. And I've worked not only in the U.S., mostly with underserved populations, but also in the third world, specifically in a few different African countries. I'm starting this web channel and this series of talks around a project which is actually a book I've been writing, which is called Shooting Up in the Dark, a physician and recovering addict's perspective on drug addiction, chronic pain, and opioids. So in terms of disclosure, I've been writing for my book for a couple of years, and I've been trying to make these videos for only a few months, and it's been a process for me of trial and error. One of the things I learned after making several videos is that I have ones that are way too long, like half hour or more, and way too detailed and more for someone taking a course on addiction than necessarily the average person who has questions. So I'm trying to make all of the videos, at least most of them, shorter and maybe present the longer ones for people who need them or are interested in more information. But so in the interest of saving time, I'm going to flash on the screen next to me here several questions, and these are all questions that you can expect to be addressed, and many, many more too, on the video channel. Usually one topic per video. While writing the book, I realized that there are so many great messages and timely needed messages in the book. And writing a book is such a process, and choosing a publisher and all of that takes forever. So I wanted a way to kind of get the message out about my experience in addiction and in recovery, just because today I'm aware of how many people are out there suffering in addiction, and the loved ones and families who are suffering because of the person in their life who is addicted. And addiction is incredibly powerful and serious problem. I think there's excellent evidence that it's a psychiatric disease or a mental brain disease. But so many people are suffering from it, not enough can get treatment, and there are so many misconceptions about these issues. And I can say that as a doctor, even though I'm not currently practicing, I'm taking some time away from medicine in part to write this book and make these videos. But in my 20 years of practice experience, before I became addicted to opioids, hit a bottom, and got clean, I know how little I really knew. I didn't know what I didn't know as a doctor. And so when it comes to issues about addiction in general, what it is and how people can be helped and what can be done and can't be done, and when it comes to the use of opioids for chronic pain, there's a lot of questions around that people have. Some of them overlap with addiction, but I really wanted to present a book and this channel about addiction, chronic pain, and opioids. So a lot of our topics will focus on addiction, what addiction is, how people become addicted, why, what it's like being in addiction, how a person can get clean if they choose to, what that entails, and about recovery, share specific experiences of mine in recovery and the recovery method that's worked for me. At the same time, I want to talk about the proper use of prescribed opioids, because there are at least 50 million Americans who suffer from chronic pain in this country, who are right now very misunderstood, and many of them are just being cut off quickly or weaned off quickly from their opioids. And for people who are addicts, who have that predilection to abuse and misuse and become addicted to opioids, that's including me, we need to stay away from opioids. But for most people who take opioids chronically long-term for pain, they're not in danger of addiction, and they face some horrific consequences when they're suddenly cut off from the opioid therapy they've used for years. And so I call this the opioid access crisis. So we also talk about this issue in several videos. And I like to give some background about me, which I'll do. Also talk about the nature of chronic pain, what it is, how it can be managed, what the role of opioids is, the medical culture in general, how we as nurses, doctors, physician assistants, nurse practitioners, and the whole medical care system interacts with patients in the United States, and the advantages we have and the pitfalls we have, especially around opioid use and understanding it, and addiction and understanding that. One major purpose of this entire effort is simply to communicate and educate about what addiction is. It's very difficult to understand drug addiction for someone who hasn't experienced it or gone through a parallel recovery process with the loved one in their life who's in addiction. So I want to share that and hope that a lot of people who have questions can benefit from the fact that I'm not only a physician with extensive experience and a few years since I got clean with medical experience and the contrast in how I approached and treated problems, but I'm also a family member of an addict in recovery. I'm an addict myself, an opioid addict in recovery, and I've been through a lot of different things. My addiction was initially to prescription opioid painkillers. It went on at a relatively innocuous level for several years, and I thought that I was immune to addiction or that I couldn't be affected somehow, but eventually I was. I started crossing lines and abusing narcotics heavily, and was in that life, thankfully, for a pretty short time. Since then, I've been in recovery, and a major part of my life is working my recovery, meeting with and helping and accepting help with and from other addicts in recovery, and trying to spread a message of recovery too. But and it all started out because I still have chronic pain. So I come at all of these discussions with really a quadruple perspective. A patient with pain who legitimately needed opioids, a person who became addicted to opioids and did a lot of damaging, harmful things to myself and others in addiction, a person who is in recovery, active recovery from addiction, a loved one of addicts and in both directions, and a doctor with extensive experience, including with pain and use of opioids and with addiction. So I'm hoping that the fact that I have all of these multiple perspectives and have walked these different paths in life will enable me to share with you some information, perhaps in a new or different way, that will be helpful. And if my videos can reach and help anyone, even a few people, then it's worth the time and the effort. So that's me. I'm Dr. John Bray-Morris, and again, this is an introduction to the video series Shooting Up in the Dark. Thank you so much for your interest in the videos, and I encourage you to forward them to people in your life who may need this kind of information or encouragement. So I'm an expert in some things. I am in addiction and in medicine and in recovery, I'd say, but I'm not an expert in social media or creating YouTube channels. So I welcome all of your feedback, even if it's critical, on how these can be made more relevant or more pleasant or just better in any way for you. And if you like what you see, please indicate that. Feel free to sign up as a member of the channel. And lastly, know that it's my intention for this to be interactive, and I will try to respond as much as possible to questions on YouTube. And I will also shape the forthcoming videos, and you'll see up on the screen I've flashed several topics that were on which videos have already been made and you can find. But I hope to be continuing to make at least one video a week, and to use your feedback and your questions to help guide me in what people want to know more about. So please let me know that. So thanks again. This is Dr. John from Shooting Up in the Dark. Until next time.